Hello, and welcome to the presentation on framework for interstate and interstate movement decisions during an FMD outbreak in the United States. I'm Dr. Jim Roth, and I was assisted in this presentation by Dr. Cheryl Aya and Jane Gallion. They helped during the two-year project to put this framework document together and the presentation as well. And we're all with the Center for Food Security and Public Health at the College of Veterinary Medicine at Iowa State University. This project was funded by the USDA National Animal Disease Preparedness and Response Program, the Farm Bill. 2 years ago, we've completed the project, and this is the final version of this framework document. The goals of the project were to help manage risks of interstate and interstate movement of animals and animal products in areas designated as free areas, and to help SAHOs determine their state's approach to managing the risk of FMD introduction spread while maintaining animal welfare, food security, and business continuity, which is a very difficult task to do both of those at the same time, to optimize both of those. The goal is to help reduce uncertainty around animal movements in the event of an FMD outbreak. USDA will set the national recommendations and requirements for animal movement, but the SAHO, State Animal Health Official, in each state has a responsibility for movements within their state. And there is potential to have a fair amount of difference from one state to another. So that we're hoping that by having this document and the state animal health officials, several of them helped in development of it and can refer to this, and maybe there'll be more uniformity in decisions. And that'll help the producers and packers to have more certainty about what will happen. And these, in this document, are recommendations and guidelines only. Responsible regulatory officials will make decisions based on information at the time of the outbreak. So as I mentioned, this project, we're at the end of the two-year period. It was a collaborative effort with a lot of people. We had a working group made up of SAHOs, producer groups, packers, USDA, APHIS, and some academics. We had several webinars where we would draft the document, have a webinar, get feedback, made changes based on the feedback. We had 3 virtual workshops, each covering a different section of the framework. And last August, we had a tabletop exercise in Manhattan, Kansas. Then in December, we gave a presentation on a semi-final version, asked for one more round of comments. Then we finalized the document, sent it out if anybody wanted to look at it to make comments. And now the final document is on this website. So we got input from a lot of people, but I want to emphasize that the final document is a responsibility of the authors. The working group and other participants did not approve this final document. So it's our responsibility, and it's certainly open to change. So in this presentation, I'm going to give the background on foot and mouth disease and animal movement in the US, which makes FMD a particularly difficult challenge to control, to detect and control, if we should get it in. Then I'll talk about recommendations for movement decisions during an FMD outbreak, especially state-by-state movement decisions or producer movement decisions. And then we've proposed state status during an FMD outbreak so that different states can be in different statuses as the outbreak unfolds and as they work towards eliminating FMD. So some of the reasons FMD is difficult to manage. We haven't had it for 95 years, so no one managing animals or state and federal officials have seen it in this country. And the clinical signs with FMD are listed here. And all of those clinical signs can be related to diseases and factors other than FMD infection. So the producers and veterinarians and others have to observe for an unusual incidence of these clinical signs. Every herd will have a baseline incidence of these types of clinical signs due to other causes. So we're looking for an unusually high incidence of these signs. And FMD is highly contagious. It spreads very rapidly. Here we go. Spreads very rapidly. So at the beginning, you might notice some of these signs, but pretty quickly, they will be very obvious in either cattle or swine because it affects a lot of the animals pretty severely, pretty quickly. Sheep and goats have much more mild clinical signs, and it's harder to detect FMD infection in sheep and goats. An exception to observing these clinical signs is that any presence of vesicles or erosions should be reported to state and federal authorities so they can be investigated. We also show on this slide handouts with the progression of lesions. We have these developed for cattle and swine, and also pocket guides with lesions in cattle and swine. Another challenge with controlling FMD is the incubation period. At the beginning of an outbreak, detection of FMD will depend on observing clinical signs followed by laboratory testing. And animals can be infected with FMD for a few days before showing clinical signs, and that's true of every infectious disease. So healthy appearing animals might be incubating FMD when they're moved and not develop clinical signs until they arrive at a new destination. The maximum incubation period for FMD is 14 days as defined by the World Organization for Animal Health Terrestrial Animal Health Code, but that's the maximum. A more typical incubation period would be 5 to 10 days. But that's still a lot of days when animals can be incubating the disease with no clinical signs and may be moved during that period. So when a case of FMD is detected in the US, according to the USDA FMD Red Book, which lays out the anticipated response to FMD, the USDA and state animal health official in that state will establish a control area around each infected premises. And animals in that control area have to have a permit from the Unified Incident Command, which is state and federal together, in order to move any animals into, within, or out of the control area. And the control area minimum size is 6.2 miles in radius, which is 121 square miles around each infected premises at least, and it can be larger. So that in a livestock dense state, that incorporates a lot of livestock premises that have to be monitored within the control area. There'll be an infected zone and a buffer zone that make up the control area. All of the infected animals in the on the infected premises will be depopulated, assuming it's not too big of a premises, and in contact premises will also be depopulated. The control area concept and stamping out were very effective in controlling 9 outbreaks of FMD in the US between 1870 and 1929. But in the 95 years since 1929, long distance movement of large numbers of animals and people and other materials on livestock premises has become much more common. And FMD may spread long distances before being detected. And I should mention that outside of the control area, according to the current USDA FMD Red Book, all the rest of the US will be designated as free areas, meaning they're free to move. This illustrates what many of you have already seen, I'm sure, the long distance spread of FMD that can occur due to human activity. So very extensive animal movements in the US every day, and very extensive associated movements, feed and other deliveries, shared work crews, employees, milk trucks, veterinarian salespeople, ample opportunity to spread this virus before we know that we've got it. Another characteristic of livestock operations in the US is that the vast majority of animals, hogs, cattle, and dairy cows, are on very large premises. But there are much larger number of premises that have small numbers of animals. And the disease has to be controlled on all of the large and small premises. So that's a lot of operations that have to be dealt with. And we have a lot of wildlife that can spread FMD, either because they become infected or because they wander from one herd to another and can carry the virus as fomites. So it's estimated there are 30 million deer in the US, over 6 million feral swine, and these are the counties that had reported feral swine in 2023. So, recommendations for interstate and intrastate movement decisions during an FMD outbreak that we have in this document. USDA will likely order a 72-hour nationwide standstill of susceptible livestock. So anything that's already on trucks will be allowed to either go to their destination or return to where they came from. And then for the next 72 hours, no new animals should be loaded on trucks. So there should be a total standstill of susceptible animals for at least 72 hours. The state animal health officials are responsible for managing animal movement within, into, and out of their state. So a permit from the SAHO or the Unified Incident Command is required to move animals and some materials into or out of a control area. So as I mentioned, the current Red Book says that all of the areas in the US outside of the control area are designated as free areas. And that means animals are free to move without a special permit. However, it's likely that the first case detected is not the actual first case in the US. And there may have been spread from the initial case detected or the ones that aren't detected to other areas of the US. So the animals are free to move without a permit, but being in the free area does not mean they're free of FMD. There's just no evidence yet. We don't know that all of the animals outside of the control area are free of FMD. So a recommendation in this document is to change the terminology of free areas to become observation areas. And this should reduce the confusion about disease status because many producers and others assume that if the USDA calls it a free area outside of the control area, that means they're free of disease, but that is not what it means to be in a free area. So we're proposing to call everything outside the control area and the whole rest of the US as observation areas to be monitored for the presence of FMD. So these areas are monitored for FMD by producers, farm workers, veterinarians, and federal and state inspectors at meat harvest facilities. There aren't nearly enough state and federal officials to monitor the whole rest of the US for FMD, especially if they're already dealing with high pathogenic avian influenza, which is a possibility. So this puts a lot of responsibility on producers, farm workers, veterinarians, and inspectors at meat harvest facilities to detect FMD anywhere else in the US. And another recommendation in this document that is a big change is that following the nationwide 72-hour movement standstill, we're recommending that the USDA implement a nationwide 28-day limited movement period for essential low-risk movements only. 28 days is 2 maximum incubation periods for FMD, and during that time, everybody will be on alert to look for FMD, because having FMD in the US will be big news, and all the producers and veterinarians should be aware of that and will be watching for FMD. So during that period, we're recommending that only essential low-risk movements occur to avoid spreading the virus further while everyone is looking for it. And then at the end of day 31, which is 3-day standstill, 28-day low-risk movements only, movements outside of the control areas are at the discretion of the SAHO and premises of destination. Those producers receiving animals are going to want assurance they're not receiving animals that might be incubating FMD. So in the document, we've proposed what we think should be essential low-risk movements. So the following movements, both interstate and intrastate, could be considered essential low-risk movements at the end of the 72-hour standstill, and should be allowed without the need for FMD-related permit. So on hour 73, these movements could just occur without the need for a permit to get things moving again. That would include movement of animals outside of a control area to meat harvest facilities. It will be important to get packing plants operating quickly to start taking care of the backlog from the 72-hour stop movement, to get animals processed so they're not susceptible to becoming infected. Another example would be movement of animals in a biosecure building to another biosecure building, according to the secure food supply plans, if it is essential to move the animals for welfare purposes. So on hour 73, if there are pigs in a biosecure building in a gestation barn, they should be able to move to a nursery or finisher that's also biosecure without needing additional permits, as one example. Another one is movement of animals from an isolated location, for example, a pasture lot building, to another location without exposure to new animals if it's essential for welfare purposes. So ruminants that have been out on pasture, an isolated pasture without nose-to-nose contact with others, should be able to move to a new location as a group without exposure to new animals in that new location. So that if they are incubating the virus, they're not spreading it to new animals. If other movements that producers think are essential and low risk, they can request from the SAHO permission to move during this limited movement period. In Appendix A of the document, we've drafted a form that can be used to request an essential intrastate or interstate low-risk movement that's not listed in Table 1. So in this draft form, the producer would provide contact information and the premises identification number from the sending and receiving premises, explain why this movement is essential, explain why this movement should be considered low risk, and if required, complete and attach an epidemiology questionnaire. So there are options during the limited movement period for other movements if they can be justified. Then during the limited movement period, there are high-risk movements that should not occur until the extent of the outbreak is unknown, and they should not occur during the 28-day limited movement period. So the following movements are considered high risk and should be avoided during the limited movement period and perhaps longer, depending on the epidemiology of the outbreak. That will include any movement of animals to animal aggregation sites, such as markets, fairs, exhibitions, shows, etc. And any movement of animals that are not immune due to vaccination, and that it'll be at least a month before we have animals immune due to vaccination, and that are not in a biosecure environment to premises where they will be exposed to FMD susceptible animals. So no movements to feedlots, backgrounders, dairies, breeding operations, etc. So we work towards business continuity, but it won't be business as usual if we're going to have a chance to stop this outbreak. So compliance with the limited movement period will be up to producers. There aren't resources to enforce compliance in the whole US while dealing with probably multiple control areas. So we need to help producers understand, and this would probably be just-in-time education during the 72-hour stop movement, that accepting animals onto their premises during this period may introduce foot and mouth disease and endanger their operation. Restricting animal movements to essential low-risk movements only until the extent of the outbreak is known provides the best chance of stopping the outbreak and recovering FMD-free status for the US. So we only have a limited period of time at the beginning of the outbreak to find this virus and stamp it out. If we don't get it stopped during the limited movement period or a few weeks afterwards, then it could spread throughout the US and we will be in a multi-year process of trying to get the virus under control. So we need to be willing to make hard decisions in that first 28 days after the outbreak. Another factor is that the price of livestock and animal products is expected to fall for the first few days to weeks of an outbreak. We've lost our export markets, so there will be an excess of product on the market, an excess of animals. It'll be difficult to establish a fair market value until the prices stabilize. So there may not be willing buyers for a while. And then something that needs to be dealt with is how to manage contracts for animal delivery. Pre-existing contracts, do they have to be honored, or will those be able to be canceled to help stop the spread of the virus? So we're putting a lot of responsibility on the producers. And the producers are the ones who are really going to be hurt by an FMD outbreak, either at a national level, even if they're not affected, and especially if their herds are affected. So they really have a big stake in the outcome of this, and we need to help them understand that. So how to provide some assurance that animals in the observation areas are FMD negative, especially after the 28-day limited movement period. There are limited resources for checking the FMD status of animals in the observation areas. Remember that the observation areas is the whole rest of the US outside of the control area. Business continuity and food security require that livestock are eventually allowed to move between premises and between states for further production and processing. We get to a point where they have to move, and there may be limited confidence that animals in the observation areas are negative for FMD, especially at the beginning of the outbreak. and accepting animals that are infected with FMD but not detected because they don't have clinical signs yet will have severe consequences for production sites. So we do have one tool already that can be used, and that is the secure food supply plans. These plans have been developed over the last few years and designed to minimize interruptions in animal and animal product movement from operations in a control area with no evidence of infection. And these plans are guidelines only. They're voluntary pre-outbreak, but if you have them in place when the outbreak occurs, you'll be in much better shape. They have specific biosecurity requirements, surveillance requirements, epidemiology questionnaires that need to be filled out when the outbreak occurs, and there's movement permit guidance. So these were designed for use in control areas, but they would also be useful in the observation areas, which is the whole rest of the US, to demonstrate that a premises is not likely to be affected by FMD and can safely move animals. Another option which we've included in this document is the FMD checked designation that can be used to reduce the risk of movement of animals in the observation area. An FMD checked herd is not likely to be infected with FMD, but it's certainly not a guarantee. A request that a herd be FMD checked before movement can be made by the state animal health officials in the sending state, if it's only within the state, and also the destination state, if the animals are going to a different state. And the owners of the premises of destination can say, I don't want to take these animals until you assure me they've been FMD checked. Each SAHO and receiving premises can decide which FMD checked statements they will accept for movements. And we've come up with various options for designating a herd as FMD checked. One option is that the relevant secure food supply plan has been in place for at least 2 incubation periods, 28 days, before animals are moved to another production site. Another option is that active observational surveillance has been conducted daily for at least 2 incubation periods before movement, with no unusual incidents of clinical signs consistent with FMD. And active observational surveillance is part of the secure food supply requirements. So maybe they've done that, but they haven't introduced adequate biosecurity or other things. So it's not quite as good as the first one. Or the animals have been housed in a biosecure environment or in an isolated location away from other livestock for at least 2 incubation periods and do not have an unusual incidence of clinical signs associated with FMD. And again, the producer or the state animal health official can decide which of these they'd be willing to accept. And the herd owner or manager has to sign a statement testifying to one of these 3 categories. Another option, if they haven't been doing these things for 28 days, as in the previous slide, is that a Category 2 accredited veterinarian can sign a statement that he or she has examined the livestock and within 2 days of movement and has not observed clinical signs, an unusual incidence of clinical signs consistent with FMD infection. And after the animals have been observed, the owner or herd manager has conducted active observational surveillance daily and has not observed an unusual incidence of clinical signs. And the veterinarian has to sign this statement. So those are ways that animals could be moved with some additional confidence that they're not infected with the virus. We also need to have a way for rapid surveillance testing outside of control areas. So animals exhibiting clinical signs compatible with FMD should be reported to the SAHO. The SAHO may order sampling and testing at a known lab for FMD virus by PCR. And this is the whole rest of the US outside the control area. We're recommending that sampling can be conducted under the authority of a trained, accredited veterinarian with the SAHO's permission. Or of course, the SAHO could have a foreign animal disease diagnostician examine the animals and collect samples if there's capacity, but we might run out of FADDs. The premises is quarantined until a negative result is returned, and documentation of any testing and receipt of negative results must accompany any statements documenting an FMD checked designation. So the next section is the proposed state statuses during an FMD outbreak. Each SAHO will be responsible for working toward FMD freedom for their state. That's how we do control programs in the US, like brucellosis, TB, and others, is state by state. The framework document proposes possible designations for the FMD status of individual states. Applying the state status designations could lead to agreement on movement between states based on each state's FMD status, assignment of priorities for the allocation of vaccines and other resources when they're in short supply, and a process for moving toward FMD-free status for the state and for the nation. The FMD Red Book does contain a possible designation of phases of FMD outbreaks for the whole US and types of FMD outbreaks for the whole US. This document proposes types for state by state. So if in the FMD Red Book, the US will be designated in phase 1 of an FMD outbreak from the confirmation of the first case of FMD in the US until there is reasonable evidence to estimate the outbreak extent. And the recommendation is that this lasts no more than 4 days, but it will depend on the circumstances as the outbreak unfolds. And the US will likely mandate a 72-hour stop movement of all susceptible livestock in the US, as I've already explained. Then after the 4 days or so, the US will move into phase 2, which is surveillance and epidemiology provides timely evidence of outbreak extent to support decisions by incident command. That's likely to be the long phase where we're bringing it under control. And then the US will move into phase 3, the recovery phase. So that's the phases of outbreaks, and this illustrates the potential types of an outbreak during phase 2 on a national scale. At the beginning, hopefully the outbreak is in a small focal area with not too many herds, and the focus will be on stamping out quickly and stop movement. If it's a little larger area, they will still stamp out as quickly as possible, but also begin ring vaccination and vaccination to help control the outbreak, but it will be vaccination to kill or slaughter. So when the outbreak is brought under control, all of the vaccinated animals will either be killed and disposed of or slaughtered and at a packing plant. If that doesn't work and the outbreak is still spreading and it's getting to larger premises, areas with larger concentrations of animals, and it becomes impossible to kill those animals quickly enough to stop virus spread, because that's why we kill the animals, is to stop virus spread. Then the decision might be to move to type 3, which is vaccination to live and allowing some herds to recover from the disease because we can't kill them quickly enough. That's a big step going from type 2 to type 3. If we get to type 3, vaccination to live, with animals allowed to recover, then it's going to be a very long outbreak. And we have to deal with the recovered animals also, and I'll talk a little bit about that. If it continues to spread nationwide, becomes a widespread or national outbreak. Type 5 is catastrophic US outbreak, the whole US is affected. Type 6 is catastrophic North American outbreak. And if we get to the point where we allow herds to recover and don't require stamping out, then there's no indemnity, because indemnity is linked with animals that are required to be killed by the incident command in order to stop the outbreak. If they're allowed to recover, it's like other diseases where the producer stands the loss of disease, unless Congress steps in to help out, which we hope will occur. So the proposed state statuses in this document, the framework document, initially, the whole US currently has historical FMD freedom. So we have FMD freedom without vaccination, which is the very best situation. It's the best for trade and obviously for managing herds. When we have one infected case in the US, we lose our historical freedom. States with infection will become FMD affected states. And states with no detections of FMD will be just that, no detections of FMD, but we don't know whether they have FMD or not because we haven't had time to adequately look. So then we follow these down to how we would handle these. And let's follow the state with no detection of FMD. Of course, if FMD is found, then they become an FMD affected state. But if they can go 28 days looking for FMD, everyone's on high alert, and they don't find FMD for 28 days, they become an FMD monitored state. And then if they can implement adequate surveillance, biosecurity, and movement controls to convince US regulatory officials and our trading partners there's no FMD infected animals in this state, no vaccinated animals in the state, they become designated as FMD free without vaccination. If we can get all 50 states to this designation, then we can declare that the US is free of FMD without vaccination and begin to convince our trading partners to accept our products again. So then we have the FMD affected state or states. They will hopefully start out in level 1, quickly stamping out all infected herds and contact herds without vaccination. If they succeed in doing that and go for 28 days with no new infections, they become an FMD monitored state. If it's a little bigger outbreak, they move to level 2, stamping out and using vaccination to kill or slaughter to slow the spread while they're stamping out. If they're successful and then go 28 days with no detections, they become an FMD monitored state and can work to become an FMD free state so the nation can be free without vaccination. This is the very best scenario if we get FMD, is to move quickly through level 1, level 2 to monitored and then freedom. However, if at level 1 and level 2 they don't succeed in stopping the virus, we have more and more states becoming infected, larger herds becoming infected. The USDA may decide to change the strategy to vaccination to live, and then states become level 3, vaccination to live with limited or no stamping out. Animals are allowed to recover, and we'll need a lot of vaccine. USDA will designate which animals should be vaccinated. So then if a state gets essentially all of the animals that are designated to be vaccinated, and That eventually might be just cattle, beef cattle, dairy cattle, and buffalo. That's what they do in South America. They can become a level 4 FMD vaccinated state. And then they will need to do a lot of testing to show that they're vaccinated but free of FMD. If we get all 50 states to this category, then we can declare that we're free of FMD with vaccination and start convincing our trading partners. Now, if the US strategy changes to vaccination to live, it's likely that all states, even if they don't have FMD yet, are going to be required to vaccinate. So then all the states would move to level 3 vaccination to live with limited or no stamping out, get all of their designated animals vaccinated, or essentially all of them, and then move toward FMD free with vaccination. So moving to vaccination to live is a really big step that probably will put the US on a long timeline for eliminating FMD. That's why we want to stop it with a limited movement period to try and stop it before it spreads too much. Another thing to consider is that at the beginning of an outbreak, the status, the decisions on movement should be based on whether it's in a control area or an observation area, rather than on the status of the state. We're still in level 1 or level 2, stamping out with vaccination to kill. And in this example, there's a control area in Missouri, 121 square miles in a control area. But really, the rest of Missouri is at no higher risk than Iowa, Nebraska, Kansas. So all of these would be considered to be observation areas. And it wouldn't be that the whole state of Missouri is now an FMD positive state. That's the recommendation. If we move to level 3, then all of the states would be level 3 vaccination to live or limited stamping out, and that then the whole state would be considered as possibly having FMD, and actually all the states would probably be considered that way. So recommendations regarding movement of animals from vaccinated herds between FMD affected states. So we've moved to vaccination to live. Animals from herds that were vaccinated at least 3 weeks previously should be allowed to move for slaughter to any level 2, 3, 4, or 5 FMD positive state. So they're going to slaughter, and they could go to any of these states. Actually, pretty quickly, we wouldn't have many level 2 states because they would become level 3. So for slaughter, animals that are vaccinated should be able to move pretty freely within the US during this period of time, as long as they've been vaccinated 3 weeks previously. Animals from herds that were vaccinated at least 3 weeks previously should be allowed to move for further production to any level 3 or 4 FMD affected state. So these states have a lot of vaccinated herds. Animals from states that are from herds that are vaccinated at least 3 weeks previously should be able to move. Something we will have to figure out and deal with is if we're only vaccinating cattle, how do we move swine, sheep, and goats? And that's something that we didn't deal with in this framework, but will need to be discussed. And another recommendation is that a meat harvest facility in a state with no detections of FMD that receives FMD positive animals from out of state should not result in the state being designated as an FMD affected state. So they don't have any FMD affected herds. One of their packing plants has received FMD positive animals. This would be at the level 1 or level 2 stage. This is necessary to encourage SAHOs from states with no detections of FMD to accept animals for harvest from FMD affected states. And this is because we need to get packing plants operating. A control area should be established at the perimeter of the meat harvest facility until it undergoes cleaning and disinfection for FMD. After cleaning and disinfection is completed, as long as there are no infected premises in the facility, the control area around the facility could be lifted and it could return to operation. And this is consistent with the recommendation in the new ASF Red Book to try and keep the packing plants operating. And of course, packing plants are private companies and they have a say in this also. Recommendation for recovered animals to be considered immune and safe to move to further production without spreading infection. Animals that have recovered from FMD should not be sent to another production site unless all animals on the receiving site are vaccinated and recovered animals are vaccinated to ensure uniform immunity. So this is after we have a lot of available vaccine and we have recovered animals, we get those vaccinated, they should be able to go to a feedlot or production site that already has vaccinated animals. So we're beginning to get back towards business more like usual. So state statuses during the FMD National Phase 3, the recovery phase. All of the states are pretty reasonably designated as free, either with or without vaccination. And then we can transition to National Phase 3, the recovery phase. Surveillance and epidemiologic evidence indicates that the outbreak is coming under control and a plan is implemented to regain FMD-free status for the nation, and possibly FMD-free with vaccination. After a state is declared to be FMD-free without vaccination, state or an FMD-free vaccinated state, extensive serologic and virus testing is likely to be required to demonstrate that the state is free with or without vaccination, and they don't have virus circulating at a low level in some herds. This testing will be labor-intensive and expensive, and it may be best to not initiate testing to demonstrate freedom until most states are designated as FMD-free or vaccinated states. If we start doing that right away, the first states that believe they're free could be testing for a long period of time until all the rest of the states are positive. So perhaps it's best to wait with this expensive, labor-intensive testing until it looks like all of the states have a chance to be free. And individual states are designated to be in the recovery phase after they file a plan acceptable to the USDA to recover FMD-free status in their state, perhaps with vaccination. So this plan contains 6 appendices, and I've referred to information in some of these already. Appendix A is a form for producers to request permission for an essential low-risk movement during the 28-day limited movement period. And it's possible this limited movement period may be extended depending on the epidemiology. Appendix B is sample collection and submission for FMDV testing by accredited veterinarian or their designees. So the accredited veterinarian needs training for this, and we may not have enough accredited veterinarians, so there may be lay people trained by the veterinarians on how to collect the samples. And this would require the permission of the SAHO in that state in every case so that they're aware of what's going on. Designation of state status of FMD is detected at a meat harvest facility is in Appendix C, and I've already discussed that. Proposed criteria for vaccinated or recovered animals to be considered immune and safe to move without spreading infection. So that goes into more detail than I've already discussed here. Appendix E is a recommended priority for vaccine use. It's anticipated that vaccine will be in short supply, especially if we get to the vaccination to live stage. And somebody's going to have to decide how the limited amount of vaccine is used. This appendix discusses that. One recommendation is that early in the outbreak, the vaccine be used to control the outbreak, whatever species, wherever, to bring the outbreak under control. If the outbreak moves to vaccination to live, and there's lots of animals to vaccinate, the recommendation in this appendix is to use the vaccine to protect our beef and dairy breeding herds. Because if we lose too many breeding cattle, it'll take a long time to rebuild the herd. Swine can rebuild much faster. Sheep and goats won't get that sick, and most will recover. And then Appendix F is the approach to a nationally standardized identification of livestock that are vaccinated for and or recovered from FMD. And this will be a difficult task and needs a lot of discussion. So all of the materials are found on the CFSPH website. The framework document is already available. It was finalized this month in March. And there's a 6-page overview handout that hits the high points. And this webinar recording will be uploaded very soon to this website also. So all of this material is available. Our grant has ended, so we don't anticipate making further changes unless some funding agency asks us to do that. But at this stage, it needs a lot of discussion by state and federal officials, producers, packers, and other interested parties. These are the people in the Center for Food Security and Public Health currently at Iowa State. We have 12 veterinarians, 3 administrative staff, and 5 graphic design and information technology people. And they do a great job and are responsible for all the good stuff on our website. You can send questions, comments to me at this email or to Dr. Cheryl Aya at this email. So thank you, and we look forward to getting comments and questions on these documents.